when I came up here, I didn't give any other senior administrator a chance to talk in the last town hall meeting, and there was a reason for that. One was it's just new direction, new time, and he just wanted you to hear one voice at that point. But what I talked about in that meeting was that I was depending on all clinical staff to understand how I approach life, and that a lot of what I do is metric driven. A lot of what I do is working off a spreadsheet. A lot of the discussions I have are with Ms. Pridgeon around numbers and how to operationalize those numbers, which means that I depend heavily on you all in this room who deliver actual patient care. I always talk about a needle. I will consistently pull the needle over to the number, and I will consistently need to surround myself with people that can help me pull back to understand that every number that we talk about is a patient. And so my partner in helping me do that and constantly reminding me that every number and every quality score that I like to stand up in front of groups and tout is a patient, and that it means that some good clinical staff provided some excellent clinical service to those patients to get those outcomes. And so with that, I'll turn it over to Ms. Beard, who is the person solely responsible for pulling that needle back to the middle and making sure that we keep the patient in the middle.
Okay, this could be a little difficult because I like to talk with my hands and I get deflated and I might throw something. Okay. So let's talk about the numbers part and the seasonality part. We've been holding 8, 9 CCU patients in the past week. Now, throughout my tenure here, I've never seen a time when we've held that many CCU patients. I've seen us hold patients, but not that many CCU patients. And these patients are sick patients. Sick, okay? So we've been holding these patients, and a lot of people say, well, they're just doing that because of the finances or because of the numbers or because we're trying to make money. I can honestly tell you that does not enter into a discussion. When we're talking about those patients, that's not a factor that we used to make a decision. It's just not. So let's talk about holding those patients. A lot of people ask the question, why don't you use PC3 for those patients? PC3, we've moved dialysis to PC3. That takes up 2 beds. That leaves us 2 beds to put patients in. We do not have a centralized monitoring system there. That means that we have to put a nurse in each room with those 2 patients. There's 2 nurses for 2 patients if we were to open that. Okay? That takes away those 2 nurses that we could have used in the ER to help take care of those patients. Make sense? Okay, so let's talk about diversion. We had a lot of questions of when are we going to divert. This was a unique situation. We actually had disaster management conference calls because in this area there was a lack of ICU beds and a lack of ventilators. Every hospital was being hit like we were. So we called around and tried to find other hospitals that we could possibly send patients to if the need arose. We could not even find a national hospital that could take our patients. So there was no place to divert to. We did find some beds, I think 3, on the other side of Nashville going south. Now let's think about this. You're an ICU patient and it's going to take us 2 hours to get you to another ICU. Not only that, but if we go on diversion, then we're asking EMS to make a decision when they pick up a patient. Is this an ICU patient or is it a med-surg patient? Is it even an admission? So we have the possibility of closing down a floor because actually med-surg census was down, which was so unusual that ICU was so high and med-surg was down. We contemplated that we might even have to close a med-surg floor because of lack of census, while the ER is being overburdened with holding patients. So if we divert those patients and we send them downtown, we also take ambulances out of service. So those ambulances are making a decision when they pick up a patient. Do they think this patient's going to be admitted? If they think this patient's going to be admitted, don't come to Northcrest because they don't have a bed. So we're going to go downtown. So now we have 2, maybe 3 units out of town. What does that do about our 911 responses here in town? That limits access to 911. and emergency calls here in town, right? So we have limited our community because of our inability to care for those patients. So that's not what we want to do either. And let's talk about loyalty. If I'm a patient that comes here for 100% of my health care, when I need you the most, when I'm at my sickest, isn't this where I want to be? Absolutely. That loyalty should go both ways. We should be loyal to our customers, especially when they're loyal to us. Let's look at the patients, families. If any of you have ever had a patient or family member that's in ICU in Nashville or in another hospital, how expensive that is, how much of a burden it is on the family, because somebody always wants to stay in the hospital with the patient. Look at the expense. Look at our elderly population and trying to have an elderly spouse navigate to another hospital to be with their loved one. So these are things that we want to take care of our community. This is our community and we care for our own. What if it's our employee, our employee's family? Do we want to divert them? No, we want to keep them here. We want to take care of them because we do good work. And throughout this whole time, everybody works so well together. Med-surg nurses, CCU nurses, ER nurses, all work so well together. They worked as a team. And that's what it's about. It's a community team taking care of a community. And even I asked coming in there, I mean, we had so much help. Jana, Stacy, and Jessica coming in there to try to help the ER. Everyone was trying to help relieve that burden. That the ER actually said, if we need you, we'll call you. Y'all go on. If we need you, we'll call you. And that's just a great feeling when we can take care of that many patients and provide safe, quality patient care. And never once do I think that patient safety was jeopardized. And never once do I think quality was jeopardized. Okay, do y'all have any questions? Okay. Thank you.
Put this thing on properly now. Everybody take a deep breath because that means it starts. All right. That'll be distracting. All right. So hopefully that was informative. One thing I wanted you to know that as we were holding this amount of patients, and still continue to hold quite a few patients, we were in constant contact with one another, talking a lot, talking with Dr. Crunk, talking with the different medical staff, talking with Dr. Dillon and Dr. Strain and Dr. Keith and the ED. When we encounter situations like that, when we're holding, it got up to 8 patients in the CCU. So we've got 8 critical care beds, and we have 16 critical care patients. The one thing that we're always watching, do we have the staff? Do we have the equipment? Do we have the space? Because of the unique circumstances of MS2, or one of the floors being had some low volume, we have plenty of staff. We have plenty of space. We were limited on some monitoring and some vents. It got a little tight, but we're able to manage through that appropriately. We continuously touch base with all the providers to make sure that at no point in time did we have any patient safety concerns. And here's the one thing that I can tell you all that we had zero concern about. It's because of you all. It's because of the quality of care that you provide. We knew for a fact, that we could hold those 16 patients in-house, and not a single one was going to get a ventilator-acquired pneumonia. Not a single one was going to get a central line infection. Not a single one was going to get a pressure ulcer. Nothing was going to happen to those patients negatively. They were going to be devoted to healing because you all knocked the ball out of the park every single time on those patients. So thank you for that. I've told you before, selling the quality of this organization is not hard. You all do a great job, and I appreciate that. What I also appreciate, and I will never ever be able to express my gratitude enough to you all, is the financial performance of this hospital over the last quarter. You're here to deliver good patient care. You're not here to be bankers. Yet I asked you to change your focus to look only at the financial performance of this hospital for the last 3 months. But don't lower your standards in terms of quality. Don't hurt a patient. high patient satisfaction scores. We never talked about that we were going to take our eye off the ball on that. So I ask you to maintain that high level of quality that you all have become so proficient at doing, yet also focus on the financial performance of the hospital. When Kim was talking about days cash on hand, let's equate it to your own personal finances. You have a savings account. You now no longer have a paycheck coming in, and you have to pay all of your bills out of your savings account for a period of time. Well, that's what days cash on hand is. You have no more revenue coming into the hospital, and you're going to live off your savings for a period of time. The bank needed us to be able to pay our bills for 80 days. So in your own personal finances, what could you do? You really only have two things. You can either go get another paycheck somehow, some way, get more money in, or you could reduce your expenses, get rid of some bills, figure out a way to kick the can on a few of them so you don't have to pay them. Anybody know what the volume did last quarter? Did you no favors? Plummeted. Outpatient volume was abysmal in November. Inpatient volume, we went for a 16-day period of time and had one of the floors closed for 14 of those days. Hadn't seen volume that low ever. So, we obviously didn't go out and get another paycheck. All right? So, the only thing that we could do was hit expenses. You all found out the way to cut the expenses. You all bore the brunt of that. I know that we asked you to go into Thanksgiving and Christmas and New Year's knowing that we weren't funding your pension, cutting your PDO accrual, and those of you who, even if you had unfortunate circumstances because of family or anything else, if you had burned all your PDO time, there was very limited sympathy, right? Because we almost couldn't afford to be sympathetic. So you rolled into Thanksgiving and Christmas and New Year's, one of the most expensive times of the year, with essentially reduced pay, and some of you having to take unpaid time off, with us offering no solutions. On top of that, we walked out 25 of your friends. And then, you got an email from me that said there's 3 things that I would like to demand from you. High morale, loyalty to the organization, and 100% commitment to the organization. But what I told you was, I just walked out 25 of your friends. I cut your PDO. I'm forcing you to take unpaid time off. I don't expect you to come to work with a smile on your face. But you know what you did? You did it anyway. And then I said, I understand that there's going to be organizations that are out there that are going to offer you the same or more in pay, that are going to fund your pension and give you your PTO and allow you to roll into the Christmas holidays getting a full paycheck. So I understand that I can't ask for your loyalty. If a job offer like that comes along, I expect you to take it. And you know what y'all did? You stayed. And then I said the one thing that I want is 100% commitment to the organization. And I didn't get 100%. I got 110%. I had people throwing up their hands on a daily basis saying, if you need to cut more. I have it to give. 100% of the managers and directors said, take hours out of our pay. They volunteered to take 8 hours out of their pay period, if that's what it took to get the number. I didn't do any of it. My job is to drive volume. My job is to go out and get service lines, to build partnerships, to better educate the community about the services that we offer. That's my job. I didn't do it. I did not help you at all in the last quarter. We did not increase volumes at all. In fact, we tanked. Yet we still hit the numbers, which is 100% you all. So I can't thank you enough. There will be no words that I can ever express enough gratitude as to what you did, except that I can tell you I do understand what we asked you to do. And you did it. And you did it while giving 100% commitment, 100% of high morale, and 100% of loyalty to this organization. So I'll say it one more time. Thank you. Now then, I don't want you to be bankers. I don't want you sitting here spending all of your time focusing on the finances of the hospital. So what I'm asking you to do now is let's just set that aside. We're not going to build a new building. We're not going to buy a new MRI. So I'm not going to be dipping into the cash. So I'm going to say that cash is set. We can never, ever, ever take our eyes off that again. You all, this is your hospital. Help me never take our eyes off that again. You feel the pain, all right? But what we've got to do going forward is change our mindset, because the next thing, really, if we're talking about not depleting cash, not making any major purchases, then the other thing is another covenant which sits with the bank. And again, I don't want y'all to be bankers. The other covenant under which we work this hospital is called the debt service coverage ratio. Forget that name. What does it mean for you all personally? If you had to equate it to your personal lives, it's your debt to income ratio. It means, here's my income, here's how much money I make, and so when I'm budgeting, how much debt can I have? How much credit card can I cover? So going forward, we've got to balance that out. So just like if you all were going out and you got your lives budgeted, and you know that at the end of the month you have X amount of dollars or this, that, and the other in these bills, but you need a new TV, and you're going to put it on a credit card, and you know that by putting it on that credit card, it's going to increase your monthly payment by $25, $40, $75. Then you, if you're budgeted tightly, have to know how much more money you need to make to cover that additional credit card bill, that incremental change. Well, that's where we are. So when we go out and we need to buy new scopes for the OR, we're going to finance that, put it on credit. Well, that's going to increase the amount of debt that we have, so we better know how we're going to cover that from a revenue standpoint. We better know if we're going to work some overtime, if we're going to get some additional volumes, what we're going to do to offset that, just the same as you all would have to do in your own personal finances. So it makes it easy. You know why it makes it easy? All you all have to focus on is continue doing the exact same thing that you're doing. We need to increase volumes and revenue in this organization. We need more patients. We're doing a great job in the last 2 weeks, but we just need more patients. We need a commitment to this community. We need to make sure that 100% of the health care delivered in this county is delivered here, or at least that we're treated as the triage location so that we can determine if it needs to go elsewhere. That's a trust. The community needs to trust us. They need to trust that we'll get them to St. Thomas Baptist, well, it's not Baptist anymore, but St. Thomas or Midtown or Vandy or wherever they want to go, but they need to stop here first. How do we get there? Well, the one thing that we've got to do is we've got to make sure that when we treat our friends and our family and our employees and major people in the community, that we provide them privacy. That they know that they can come here and that no one needs to know that they were here. And there's a lot of talk that goes on. And when high-end people come into this organization, there sure is a whole lot of chirping in the community about them coming in here. And you know what they're not going to do? They're not going to come here anymore. So I've had the wonderful opportunity to go out and talk to business leaders in this community. Hale and Cotton, the director of the schools, Electrolux, to be able to go out and just sit down and have a one-on-one conversation with them, and first of all, talk to them about their employees. What do your employees think about the hospital? And you know what? It's the same as the community. You get kind of a mixed bag. Some of them like it, some of them don't. The ones that don't typically are the ones that they still remember the Jesse Holman Jones Hospital and all these other things, and you go, well, have you used us recently? Well, no. Okay, well, give us a shot, right? Pretty easy conversation to have there. But the other thing that I'm finding is that the leaders of the community don't necessarily use this hospital. We've got to change that. But the first way to changing that, before we begin demanding that, is they have to have the expectation of privacy. So just focus on that and make sure that when you see these people coming through, that you don't talk about it. It is hard not to, and I understand that. When prominent people in the community come through, it's so easy to want to talk about it. But we have to give them the expectation of privacy, first and foremost. Now then, we're out there and we're talking to the community, and I can tell you it actually resonates with them when we start talking about their community hospital. 850 employees in this organization, and I do believe that you all are true ambassadors for it. I think that you're 100% committed to the mission and committed to everything that we do, the culture and the people. And I think you want to see this place succeed. And so going out and talking to people and saying, we need you to support your community hospital. Because it's very easy for me to just simply go, you know what? It's y'all's hospital. I've just been chosen for a brief period of time, and I don't know how long that will last, to be the leader of that. And by the way, I'm talking relatively. And I serve at the whim of the board. So I'm here for a window of time to run your organization. And I'm here for a period of time to run this community's hospital. And it is this community's choice as to, are we going to remain a not-for-profit, independent hospital sitting here providing an outstanding and delivering an outstanding mission, which is providing health care to this community, or are they choosing to just simply abandon this model? And then my job becomes finding that hospital management group that is philosophically aligned with this community. I don't want that. I'd prefer that we remain independent. But the community does have to choose. And I think that we've got 850 people here that choose to remain exactly the way we are, delivering the mission in the way that we're doing it. So when we have that conversation, when I have that conversation with anyone out, it does resonate. And I think that the feedback that I'm getting is that they want an independent, not-for-profit community hospital delivering health care in the way that we're doing it. That's what I get. So what do we need to do? We first need to begin demanding that health care be rendered to our citizens in this facility. It's the first demand that we have to make. And what that means is when you go see your primary care physician, if they try and send you elsewhere, that you've become educated about the services that are rendered here. And that's my job too, from a marketing standpoint, to make sure that everyone knows what we do and the quality in which we render that care. So that you can talk to your primary care physician, you can say, no, I want that service done at Northcrest. The same thing as you're talking to your specialist. I don't want to go to 100 Oaks. I can do that here. So that's an education from the patient standpoint, to make sure that you can provide that feedback to the provider so that we can get the care rendered here. Now the other thing is, sometimes we stub our toe. I can tell you that when a patient right now comes into the lab or medical imaging, from the patient satisfaction scores alone, y'all are knocking it out of the park. You're 99th percentile on patient satisfaction. Patients love coming to see you. They think you're great. I think you're great too. That's outstanding. We provide service focused on the customer. Hands down. We have a servant-like attitude to patients when they come in here. And I think that resonates. And all the patients reflect that. Now, what we've got to make sure, though, because we've had just a maniacal focus on customer satisfaction, but customers to us was always the patient. We need to broaden that a little bit. And I would never have stood in front of this group and asked you all to broaden that to providers before. There's a reason for that. The medical staff is going through a culture change. They've adopted it. They've requested it. That they begin looking at their role in the care team as a leadership role, one of being a mentor. That hasn't always been the culture. Dr. Crunk, Chief of Staff, be the first one to stand up here and go, no, The culture before wasn't necessarily one of wanting to teach and develop the care team. It was a little bit more of berating. So it's unfair of me to come to you and say, please consider the providers as a customer, when the customer treats you in a manner that you would typically fire them in any other retail situation. You ever heard of firing the customer? Okay. So it's not fair of me to ask you that, but what I can tell you is that they are absolutely committed to changing their mentality into how they deal with this organization. But I can also tell you that they are committed to this organization as well, because they went through this whole change with us. The last quarter was tough on them too. So we have to broaden our view of customer service. So what I'm asking you all today, to help me to make sure that we're going to grow volumes for this organization, continue being an ambassador for this organization. When you go out there, if you have something negative to say, don't say it, because to me, negative means improvement. It means that you have in your mind something that needs to be improved. That doesn't need to be talked about out there, and I'm not saying keep it a secret. I'm saying that if you have something negative to say, you should be getting it up through your supervisor and up to me so that we can make changes, real changes. Right? And I'm not even saying I would suggest that you bring a solution with any problem, but sometimes you may not know the solution. You don't know the big picture and how everything fits together, but you do know the problem. Voice it. Get it to us. But that doesn't need to be voiced out there. No one out there can fix anything. It's only in here that we can fix it. So let's make sure that we're ambassadors, that we're being positive, that we're focusing on the positive, and make sure that you educate yourself as to what we do and the high quality in which we do it, so that when someone asks, so what's going on over at the hospital, you can actually answer that question. All right? Do that for me. The other thing, let's just focus on broadening that customer service aspect. Y'all are kicking butt on patient satisfaction. Patients come in here and they love the facility. They love the food. They think we're clean. They think they're communicated with in a great way. Y'all are doing very, very, very well. So now we just need to broaden it. We need to be easy to use for physicians, providers. So when patients come in here and they have lab work and medical imaging done, and they have any other service, I'm just focusing on them, but if they have any other service done here, we need to make sure that we get that information back to those providers in a timely and efficient manner. Accurate. That when those inpatients come in here, that we transition them back to their primary care physicians with the right information. Here are the medication changes that we made. Here are the appointments they need to keep. We've got to make sure that we bridge the gap in all areas. So what I'm asking you all to do today, let's stop being bankers. No more being bankers. Don't take your eye off the ball. Keep expenses down. Don't lose sight of that. Keep doing what you're doing. But let's move forward and deliver excellent patient care. But let's also become the easiest healthcare organization in the state of Tennessee to use. The easiest. Let's have people want to send their patients. Let's make inroads into that Clarksville market. We're easier to use than any other organization around here. I promise you that. So let's get the word out, but let's live it. Because that's the way that we're going to get volume. Because if we're doing the right things in the primary care physician's office, then the patients are not going to be admitted to the hospital. We are changing to a quality, preventative, and wellness model, which means less patients coming in for inpatient care. It means you've done a good job. If you appropriately communicate with these physicians, those patients don't come back. That's the right way to be. Now then, we need to focus on broadening that market, and the way that we broaden it is by becoming the easiest healthcare organization to use in the state of Tennessee. I think we can do that. I think we're just one click away from that. Does that make sense? Okay, so I'm going to end it there. Are there any questions about anything that we've talked about at this point? All right, perfect. Once again, thank you for everything that you've done. Thank you for what you have done and what you will do. Thank you for working with me and partnering with me, because I think that we're going to set the world on its ear. And thanks for going down the journey with me. With that said, if there's no further questions or any questions, I'll let y'all go back to your work. Thank you.